I was a little unclear as to whether or not, from the family practice standpoint, whether or not there will be 3D materials that are introduced into the testing programs that are done by the local optometrists. Is that something that you're talking about, is the actual use of 3D materials to help as a screening mechanism for eye disorders?
Yes, that's a very good question. Once a person comes for a comprehensive eye exam, we traditionally check all of these things. And we do ask, and we do actually a stereo test in the office as part of a comprehensive exam. Also, we're looking at eye muscle alignment. We're looking at the accommodative positionings of the eyes. We're looking at refractive imbalances. We're looking for disease entities that can also cause deficiencies in 3D. Keep in mind also, you know, systemic diseases can affect this as well. So a patient with, let's say, diabetic retinopathy, they may also have problems experiencing 3D, but maybe because of another reason. It may be a retinal problem. Also, patients suffering glaucoma may have a problem, and that's related to the optic nerve and the conduction of the impulse to the brain. So there's many things that we check in a comprehensive eye exam. Those things will continue to be done. What the opportunity here is that there's many people that have asymptomatic problems that aren't going to the eye doctor. And this will help give them a reason to go. If you recall, I said that CDC did a study, and we've been doing that now since 2005. We've been asking adults age 40 and over why you haven't gone to an eye doctor. We thought they'd say, oh, it costs too much, I can't find them, too much trouble. No, they said no reason to go. So now this is giving them another reason to go, and it's also giving them a reason to take their children and their grandkids. That's the opportunity here. Once they're in the chair, we can take care of them. And if we get them in the chair quicker, we can treat that better.
Just as a follow-up, will either in theaters or in packaging for 3D TVs, will there be any information that suggests a person who's not perceiving 3D properly to go get an eye exam?
You're reading our mind. The next steps here will be, if we, the idea will be to have theatrical PSAs before the movie, and also information at the end of movies. And there's also the possibility that content can be delivered into the home through a certain mechanisms, which will allow individuals to perhaps test their vision at home. So in answer to your question, yes, that's going to happen. When, we don't know, but that's something that we are working on as a next step.
I want to add one piece before we get to the next question here. I thought that was a great question about integrating stereopsis and depth perception into the exams. Just so you'll know here, actually we've been an advocate for this over the last 10 years. In my home state of Kentucky in the year 2000, we do have a law that asks for a comprehensive eye examination before entrance level of school. And part of that entrance level examination, in fact, is binocular testing, stereopsis, so those things are going to be screened there. Unfortunately, now we only have 3 states in the country that require this before school. Those are the states of Kentucky, Illinois, and Missouri, and hopefully we'll have more states in the future because, again, this is showing up the aspect of binocular vision. There's more to vision than just covering one eye or the other there in the screening.
Any comments, too, from the consortium about this idea of the teachable moment? Because I think you brought up a very good point, is at the point that people experience this technology in the home or in the theater would be a natural point of education about the benefit of care. Do you want to speak to that first? Yeah.
It's a natural for this alliance created here to focus on this type of application. I don't believe for a moment that we are all up here to try to sell fundamentals of better viewing of 3D entertainment. What we're doing is we're collaborating on ways to enhance the quality of life. And if the same vision issues that create uncomfortable 3D can be traced back to attention of our children in school, reading disabilities, other things that have much more fundamental problems, this makes all this work extremely important. And that's why we're so excited about being part of this.
I think Dr. Sheedy was quoted actually in a video that's going to be distributed tomorrow as saying it was a blessing in disguise. I sort of stole it from you, Jim. But maybe to comment from your perspective too, with the clinical work that you've done, emphasizing that point, because that is the essence of this collaboration.
Yes, you know, optometrists for many years, we've been the vision specialists. We understand vision, how it works, how it functions. We've been analyzing children, as Dr. Ellis points out, for learning issues. We know that certain aspects of the visual system and how it works, we're able to measure it, and we're able to analyze it and be able to identify some of the fundamental underlying diagnostic conditions that cause the types of problems that we're seeing. We believe that many of these same conditions are the ones that are challenging people in watching 3D displays. They're almost certainly many of the same conditions. But we're also prospectively looking forward at this. And this is one of the reasons we're setting up a special clinic to examine this. You know, are our assumptions correct? Can we use our current techniques, which are really good, to identify all the people with problems? Or is there something else we should be measuring? This is why we're going to be looking at other measurements that we're going to be adding to our clinical routine and exploring their feasibility and their effectiveness at giving us better diagnostic capability. And I've enjoyed the partnership with 3D at Home and Rick Dean and his leadership and Phil on helping us to implement this so that we can learn more about the individual problems that might exist. And certainly, based on everything we know, the problems that the underlying conditions that cause the problems people are having at 3D are the same conditions that are causing them to have compromised performance in other aspects of their life. And if it's a kid, it's learning. And you know, that's probably the biggest focal point that gathers attention. But it also could be affecting people and how they're in their work. If they're working on an assembly line and it's important to be able to put a certain part on top of another part, you know, the problems that are challenging their 3D is probably also causing a poorer performance at work. And as a performance metric, it's a comfort metric. So, Barry, that's a long answer, but what was it you quoted me as saying? That's a blessing. It's a blessing in disguise. Right. So if people are, and that's sort of the premise here, that if people are having problems at 3D, you know, the underlying cause of that is causing them problems in other aspects of their life, whether they know it or not.
Very important. Sure, go ahead, Paul.
I just want to add one thing that bridges these two comments. You know, Rick said that we're not here to promote and sell, you know, consumer electronics entertainment. If you look at the way that technology has developed itself over the years, this is a prime point of inflection where we have technology being developed at a price point that can be deployed to the home and help bridge the gap of, right, filling the gap with scientific evidence and putting into practice things that help the people. Not to make money, things that actually enrich the lives of the people. And that's the important thing for me, is the takeaway, is the role of technology in that. Not that we're trying to sell entertainment, because that's not the point.
Good point. Let's take some more questions. Yes.